So really common reason that people see me is because they have leg pain, and like you're saying, if sometimes you don't know if it's coming from your back. If you have pain in your leg, you think it's coming from your leg. But oftentimes if the pain is traveling further down the leg, so starting in the back and radiating kind of down the leg past the knee, sometimes it goes to the ankle, sometimes you get it in the foot, or you feel numbness and tingling, that's often a sign that the pain is actually maybe coming from your back. So we call that a radiculopathy. Some people call it a sciatica, so you may see that or hear that term often, and they kind of mean the same thing. You can have this for various reasons that kind of can take a while to get into, but one of the most common reasons that you can have this is a disc herniation or a disc bulge. So in your back you have discs in between all of the vertebra, and sometimes a part of that disc can either protrude out or bulge out and put pressure on a nerve. And when it puts pressure on a nerve, that nerve does not like it. It gets angry, and it lets you know by sending pain going down your leg. Also numbness and tingling and those kinds of things. And depending on where the pain is, we can often have a good idea of what nerve is being pinched, because each nerve provides the sensation or pain or function in a particular area. So depending on where the pain is, we oftentimes can have a good idea of what nerve is being aggravated even before we get an MRI to show us anything. So anytime anybody has this, the good news is that the vast majority of people will get better without ever needing surgery or needing an injection or anything like that. And rest, anti-inflammatories, exercise, stretches, those kinds of things oftentimes will be enough to help get somebody through this period and get the pain to improve. And most of the time that'll happen over the course of about 6 weeks. But if the pain's not getting better, or if it's getting worse over that time frame, then that is definitely a time where it's a good idea to be evaluated for that. Reasons that you should probably come in sooner would be if you know that you have really bad weakness. So if you can't lift your foot up, for instance, or you're tripping or something like that, that would be a more serious sign that you should be seen sooner rather than waiting, more than a few weeks. So if you do come in and see me for that, and we've tried physical therapy, we've tried anti-inflammatories and medications and different things, typically the next step is to get an MRI, which will show us where the disc herniation is and allow us to confirm the diagnosis that we think. Really at this stage, the next decision is whether or not surgery may be something that would be necessary versus other non-operative treatment options such as an injection. So injections can be useful, particularly in cases if the pain maybe is getting better, but you're still having some discomfort and it's affecting your activities. An injection can be helpful in that sense to help decrease the pain and give you some more time for the body to kind of heal itself. So typically there's two reasons why a nerve will be aggravated. One of them is just the mechanical compression of the disc pushing against the nerve. The nerve doesn't like that and it gets angry. And then the other reason for pain would be chemical irritation. So when you have an injury, your body often releases chemical factors and stirs up some inflammation, and those inflammatory chemicals are irritating for the nerve as well. And so the anti-inflammatory medications as well as injections are geared towards helping that inflammation portion of the pain. So steroids or steroid injections are very potent anti-inflammatories that work on the chemical irritation, because the body oftentimes can accommodate or kind of get used to a little bit of mechanical compression over time, so that the pain becomes less and less. And then in certain cases too, the actual compression may lessen over time as well, which can ease some of the pressure off the nerve. And when that happens, then a lot of times the pain will get better. So injections can be helpful in that sense. The injections, unfortunately, are not always perfect and do not work for everyone. Sometimes the medication can help with the pain for a few weeks and then the pain recurs. If that's the case, then oftentimes in that situation, we look at surgery as the option to actually take the compression off of the nerve by removing the disc that's pushing against it and relieving that pressure, and thus relieving the pain that it's causing. For the low back, no, we don't. There's not anything really that we have to replace the disc with. There's not like a patch or anything that we can put in there at this time. We've tried a bunch of stuff in the past, but none of it's really worked. But we just only remove the piece that's free and the piece that's pushing against the nerve. The remainder of the disc we leave in place. So it's only really a small portion of the disc that we take out.